he has some type of tremor going on sometimes,
Yeah.
and sometimes he wakes up and I think he really does forget where he's at, so he's an elderly dog, and it's
Sure.
just going to crush me because I
Yeah.
just can't take it to think about not having him around. Now you'll probably hear him because there'll
It's
be
okay,
somebody
you
that
might.
comes too close to the house, so he'll have to tell him what's up. So
Yeah. Well, I see people are logging on, and so
yay.
that's great. I just sent the notice out this morning, even
Yeah.
though we have this, every month. We always have an office hours. We have for quite some time, and but I was so thankful, Holly, that you were
Sure.
able to, jump on board as you did. This is the second time you've got to present with us, and you're always fantastic.
Well, thank you.
And so welcome everybody. I hope we have a lot more people logging on today, but the session is being recorded. So I will introduce Holly here in just a moment. I'm going to give everybody maybe another minute or two. I just have 12 o'clock as we speak. So,
I
and
don't
some
have
people may
anything
be in.
going on. If we go over, it's totally cool. It's all right.
Okay. All right. Okay. And Holly, just to, I know I went over this in our email and things like that, but our Appalachian Diabetes Network it's not only located in West Virginia, but we cover the whole Appalachian, 8 out of the 13 Appalachian states. So we have some folks on Central Time with us as well. And I think that would be Miss Sharon Haynes, who is has been with us for quite some time now as lead coordinator in Coosa County, Alabama. And while we just have a few people on right now, we probably won't get a chance to introduce everybody, but just while we're kind of killing time and before I do introductions, I will open it up just so that we can kind of have an idea of what your coalition is about. And because Holly's going to be talking to us about improving heart health across Appalachia. And some of you may have remembered her from last February. I think you had joined us. And so you gave us a lot of good resources. And I think this time we've kind of put a different spin on it. So what happens once you, have heart disease, and what do you do? So that kind of a more tangible for the community too. I think it's a good piece. I'll open it up, and I'm going to ask Miss Sharon Haynes to introduce herself and just tell us just a snippet. Good morning about
Good
county.
Good morning. How are you guys? Good morning,
great.
Holly.
Good morning. How are you?
Well, first of all, I am the coordinator here in Coosa County. That is the home of Rockford, Alabama. That's the county seat. Our population is under 11,000 people, rather. We have just rekindled our health department back. We were the only county in the state that did not have a health department. So we are very fortunate this year to have our health department back. And so we are partnering with them on a couple of workshops and programs to kind of get people back acclimated to the health department and utilizing the services. So Holly, you're right on time, because tomorrow, our coalition, we will be putting on a called Be Heart Smart, a lunch and learn program over in the Goodwater area. And so some of the information that you gave last year, I'm using it for tomorrow. So
I love it.
So you're right on point, and this is just perfect timing. So I'm very instrumental in hearing your talk today as well.
Sure.
Awesome. Thank you, Sharon. That's great to hear.
Yeah.
That's some good stuff. All right. And Christy is with us, Christy Halsey, and I'll let you tell us all about Wyoming County, West Virginia.
Hello, how are you all doing?
Great.
My name, like Sheila said, is Christy Halsey, and I'm down here in Mullins in Wyoming County, West Virginia. I am the executive director of Rural Appalachian Improvement League, and we just try to improve life in rural America down here in Wyoming County. We have just finished up a Dining with Diabetes series just a few weeks ago. And we do gentle yoga here. We team up with different partners in the area. We want to start taking the gentle yoga into IDD clients through Southern Highlands. I met with them last week to see if we could start bringing some of the activities that we have here to them.
Mm-hmm.
So we have gentle yoga, we do line dancing. That's actually my favorite. I have a good time doing that, releasing endorphins and having a good time while exercising. And then we also have a community walk here that we do. And we're always looking to improve and see what's out there and implement here. We also have health fairs here as well. And we'll be hosting one of those sometime this spring.
Oh, that's great. That's a good
Nice.
job.
Thank you,
So
Christy.
down in your neck of the woods, we have Tug River, I think in Pineville. They just joined us with Target BP, and they're an FQHC. They came to us and we were just like so tickled. And I can talk a little bit more about that in the, when I get into my slides about some of the things that FQHCs and clinics and things that, out in the community that they can kind of partner with us, but we were tickled. Her name is Kelly Lester. That's the lady I'm talking to there. I don't know if you know her or not, but
I think Sheila connected me with some people at Tug for our Dining with Diabetes class.
Oh, cool.
So, yeah, anything, we're always looking, for community partners. So that'll, that might be a good connection with this.
Yeah.
Okay.
Thank you.
Mm-hmm.
Thank you, Christy. And I only see two other people, and one is from our division, Community Health, and we've got some other people joining. But just so we can, I didn't want to have to, sometimes we have 15, 20 people on here.
Oh, yeah.
So we can't do, introductions for everyone. But since we're already like 6 minutes into things, what I'd like to do is I'm going to go ahead and introduce Holly, and then I'll just ask you as you join in, if you've not already introduced yourself, then just put your name in the chat box and your organization and the county and state that you represent. That would be awesome for me to keep a log on that. And then if you have any questions, Holly, I'm just assuming we'll just raise our hand or whatever. We'll just keep it as casual as possible. Or you can put it in the chat box. That'll be fine too. And then I can bring that to Holly's attention. And Holly, do you have your slides? Did you, so this is set to share the screen. So I'll let you go ahead and do that. And then I'll make sure that that's going to work. And then I'll give you an introduction.
Okay.
Awesome.
Sure you can see my screen.
Mm-hmm. Okay. And welcome everyone to our February office hours. And my name is Sheila Pogger, and I'm with Marshall University Center for Rural Health. And today our guest speaker is Miss Holly Mitchel. She's in the West Virginia Community Impact Director for the American Heart Association. Holly is from Shillian, West Virginia, and is a WVU alumni. She received a master's in public health in 2005, and Holly has been interested in rural health, women's health, and providing opportunities to meet people where they are. To learn more about heart health, she lives in Charleston, West Virginia, with her husband, Barry, daughter, Lily, and she has 4 wonderful dogs. Getting outdoors and every chance she gets, that's what she likes to do. And so I'll welcome her, and Holly, I'll just turn it on over to you.
Oh, thank you so much, Sheila. And I appreciate you guys so much inviting us back. So it's like, hey, we weren't so bad. So they want us back for some updates. That's so good. We do have a lot of stuff to talk about, kind of like a part 2 of what we talked about before last February during Heart Month. But I'm so glad we do kind of have some repeat people that came by, and that was really nice to kind of hear them to what they used last year. Feel free to use any of our resources. We do have a resource slide at the end as well. Not sure if they were the same ones, but we do try to put some new statistics in there. Let's see, does this not work? Okay. So we're going to talk about really what heart disease is and the prevalence. We're going to talk about the prevalence in Appalachia. And then participants at the end, treating heart disease, what are the benefits of detecting it early? And also, if you're a caregiver or you're talking to a caregiver that has someone that they are helping and they're diagnosed with heart disease, how can they take care of their own health and also their loved one? And then also, again, with more resource information, what we're doing with the, the influx, I guess, there's some more programs that's out there that's kind of in like for CPR, and we'll talk more about that. But what we're doing at the American Heart Association for heart health. Okay, so I'm going to move my slide over so I can see everything. Unfortunately, chronic diseases, this is a chronic disease, heart disease, and it's 6 in 10 folks in the United States are suffering from chronic disease. I kind of wanted to show like a broader view of what we're talking about because, folks were mentioning diabetes, interventions with like dining for diabetes. And that's kind of important too, because it seems like with chronic diseases, they all go hand in hand, right? So we're kind of whittling down about what is really important. In West Virginia, we're number 2 in the nation for hypertension. I'm just trying not to be so sensitive with these slides. Oh, I did it. So I wanted to kind of give what hypertension, here we are, 58%. Heart disease ranges in that. But with heart disease, a lot of times, there is some type of comorbidities that are going on, right? Folks with heart disease, sometimes they have more, there's a prevalence of diabetes. There's a prevalence of heart failure, depression. There's lots of other things that's going on. And I kind of wanted to show you a little bit about what, the pulse of that. Okay. Sorry, my slides are jumping around. So high blood pressure is very common. 1 in 2 adults have high blood pressure. Is there anybody on here that has high blood pressure? Oh, and you're being treated for it? Yep. So what's important with what we're finding too is that you have to know your numbers. And a lot of folks around, they don't know that they have hypertension or any type of problem because they're not monitoring it. It's not what they they feel fine, so we're just like, the first thing is like, do you have any hypertension, so because it's so prevalent when people actually get diagnosed, they were having it all along, but they had no idea. So, okay. So what happens to your body when you have hypertension? So many systems can be affected: stroke, vision loss, heart attack, kidney disease, sexual dysfunction, heart failure, lungs, shortness of breath, COPD is also in there as well. What a little kind of a side note is that how many people notice that when you're at your dental office that you're getting your blood pressure taken? I have. And I'm like, hey, what are you doing that for? Oh, we're just seeing if you're healthy for this procedure. I'm like, I'm getting my teeth cleaned, like, what's up? And they said, oh, we do it in everybody just to see how things are going. Well, they just really didn't know, but the dental industry has really helped us out in filling the gaps of folks that may not have had their blood pressure monitored before, or, every 6 months, right, is when you get your dental checkups and things like that. Just a couple of years ago, a lot of states are doing this. West Virginia was one of them, is that recipients for Medicare, Medicaid, they were getting a bump up in their dental benefit coverage. So a lot of them were going to their dentist. Maybe they didn't have a PCP, but they were going to their dentist and they were getting their blood pressure checked. And they kind of was figuring out, wow, your blood pressure is really high. and they didn't know it. So they were trying to get them into, some type of system where they could take care of themselves at another, like, clinic or a cardiologist or somebody. So I had an idea that, a lot of the dental offices within the FQHCs, we will give them cuffs to start initiation, like blood pressure monitoring for patients, maybe who haven't had that before. So a couple of our offices that have been working with us told us, you wouldn't believe this. We started doing this on some of our patients, and they've made numerous referrals to the medical side of the clinic because these folks, their blood pressures were off the charts, and they said they felt fine. And yeah, one of the ladies, she had a procedure scheduled. She came in, they did her blood pressure. They said, hey, you need to wait. Your blood pressure is really high. Let's take it again. You rest for a second. About 20, 25 minutes later, they took it again. It was even higher. And then they sent her home like, hey, maybe you should just wait and come back. She said, no, I'll come back. I'm going to have lunch with my mama. Comes back after lunch. It was still higher. And they had to send her to, I think, St. Mary's, and for a hypertension crisis. And my understanding is that, it wasn't like an actual heart attack, but she was having an increased, blood pressure. So thankfully for that, just for this little bit of monitoring, she's now getting to see a cardiologist and being treated for her hypertension just by going into her dentist's office. So keep that in mind. And we would love to start more of those. So if you know anybody that would want that, a dental office doesn't have to be with an FQHC, but we definitely need that because we're supporting that gap filling, if you will. So some key findings in Appalachia, and, we've talked about this before, but it's still kind of there. Some of the, we have higher statistics for some of the worst chronic disease problems in Appalachia. So I won't read you the statistics there, but it's like a lot of what we're experiencing is higher than the national average. And we, because I live in Appalachia too, we're unique because we have some barriers that other places don't have. So we kind of not only like to overcome the regular barriers of health, but we're also talking about other barriers in Appalachia that we have to overcome. So if you don't know, this is Appalachia. And if you're on TikTok, sometimes you get lost in all these paranormal stories about Appalachia. Makes your heart race a little bit, cardio. I love learning more about Appalachia, the culture. West Virginia is the only state covered completely with the Appalachian Mountains. I love it. But these are our folks. These are our population. And if you live here, it takes a minute to get anywhere. So that's why a lot of our problems is transportation, accessibility, people having jobs and taking care of themselves. It goes hand in hand. So another group that I really wanted to pay attention to as well is women. And especially this month, we have Go Red for Women. Cardiovascular disease kills more women in all forms of cancer combined. So that's 44% of women. And my guess, it's a little bit higher because as women, we don't really report much. We have to go on. We do all the things, right? Last, probably to make yourself a doctor's appointment when you don't feel good because you're taking care of all the things. So I won't read all the other statistics there, but, special groups, heart disease kind of hits us differently. We have different seasons of life that men don't have. We have babies, we have menopause. There's other changes that's going on physiologically that we definitely needs to make sure that you're monitoring your blood pressure. And mine has been okay. Sometimes I do have one child, and sometimes she does get my blood pressure up a little bit still. But I tell her, it's like, you got to start taking care of yourself, and it has to start with you. And we talk about healthy habits and all that good stuff. So, and more minorities, and especially minorities in Appalachia, it's, a very, very small group, but this blows my mind every time I read it. It's 51.9% more higher blood pressure deaths with, and it's this called the silent killer with Black females. They have 57.6 that have hypertension with any other race or ethnicity. And I work with a few folks in New York, and I think it's New Jersey and probably Philadelphia, that they're really trying to do something with cardiovascular disease with Black mothers, because it's the #1 killer. And I wanted to raise that and let you guys know, that we are monitoring this. We are putting programs out. We are partnering with community groups as well, because this number has not changed. And as much as we want to do and throw awareness, we really need to do more action with this. So cardiovascular disease kills more than 50,000 African-American women annually. And African-American women ages 20 and older have 49% have heart disease. So it's higher than the national average. So some of the barriers to health, as you guys know, lack of space. There's hardly no places to walk. Even around Charleston, where I live, there's really not. There's some river walk around. There's a couple of tracks with some of our football fields around, but it's still not as accessible as you would think. And what I always like to say too is meet people where they are. Like, what if I was living here? How would I exercise? Where would I get my healthy groceries from? Who would I see as my provider? So I look at all these things, and a lot of folks in Appalachia share this with folks that live in West Virginia, or there's hardly enough, like we were thinking about health, that you're really thinking about survival at this point. So there's limited access to medical specialists in some of the smaller towns in Appalachia, healthcare, insurance. There's lots of other things. I'm sure you guys could think of other factors that can contribute to it.
Holly, I love that you meet people where they are. Because, I know you live in Charleston, and for folks who is not aware of Charleston, Charleston is where our capital is located. So, you would think that in Charleston, there would be plenty of areas to walk and things like that.
Yeah.
But I know, and I'm sure you guys know, that in our rural communities, there's the accessibility of just to get to a walking track. It just doesn't happen all the time.
No.
And so people become very isolated, and because all they have is their house. They live in an apartment community, or they live in a housing development, or they live up a holler somewhere like me, and so I love that that you take the extra step, and you think about, this is a target population over here, and what are their barriers for accessibility, for physical activity or healthy eating or anything. Because I love that. Thank you.
It really, oh, sure. Thank you. And it really helps guide your programs with your FQHCs. I'm from Shillian, like you said, and it's at the eastern end of Kanawha County, where Charleston's located. But even just 25 minutes outside of Charleston, it's a whole other world.
Sure.
It's a whole other world. There's some, tracks and stuff around, but you still have to have a car to get there too. And not that you have to have everything outside of walking distance, but a lot of the terrain where people live on, they live on hills. It's like this. You can't just walk in your yard, because I live, like, my backyard is exactly like this. Also with Charleston proper, beside the Capitol, it's a food desert. Call it or food swamp, I guess, because they are some food, but it's fast food. And that's right next door to our Capitol. There's no fresh markets. It's down a couple of streets, but there's no fresh places to buy groceries or anything like that. And that's the East End. And that's just one example of the urban problem that some folks have. They live in a big city, and they still have problems exercising and finding healthy food. So, yeah.
Thank you.
Yep. I'm going to see if I can do this link. I might have to go out, but I wanted to show you this. And I know you're going to have the slides. Here we go, which is so great. Let me know if you can see this after it goes to this page. Can you see my diagnosed with heart failure? Okay, share new. Here we go. Just to touch on this, because I didn't want to put it all on one slide because it's ginormous. But diagnosing heart failure is so multifaceted. Depending on what is exactly wrong with your heart, what symptoms you have, what's going on with your health at the moment, getting diagnosed. And this is where the American Heart Association urges folks to have a really great relationship with their medical providers. Getting back into the dental offices was a big thing, but also going back to your PCP, going back to your doctor. Like, folks during COVID, they didn't want to go in to see their doctor, or they couldn't, they had to sit in their car, or they had to do different things to be, assessed for appointments that they already had. Believe me, I took my mom, she had like 7 different doctors, and each one was different. It was like, come, call when you're at the outside, or we'll come to you. And, so it was just really different. A lot of folks, really haven't had that routine visits, and it's still, we're still kind of getting back really to things as normal, a new normal, but we definitely want folks to start talking to their doctor about any type of problems. So with early detection, what's really important is to have that baseline. And that's what we tell FQHCs when we work with them, is that there's different programs that we can provide that can help their patients, maybe patients who are not really diagnosed yet with heart issues and they're brand new to the program. Maybe they need a self-monitoring blood pressure course to take and have a cuff from us that they would have. And it really helps empower the patients when they start monitoring things themselves. Again, meeting them where they're at. So you give them a cuff, they don't have to come in all the time. They can do it at home, monitor at home. Community health worker can stop by. A lot of folks in the FQHC world are starting to do community health workers to go out to homes. It's easier that way, especially some of the older populations that can't get out and notice that there's anything wrong. So with, reporting them to your doctor or community health worker or home nurse, that's happening. Or nurses call patients when they're enrolled in the chronic disease programs, such as self-monitoring blood pressure, that they're going, hey, is any changes? Like, oh yeah, last week, and they have specific questions they can ask him. Well, last week, why did your blood pressure go up? Well, I don't know. Maybe maybe they're not on any medication or anything like that. Or maybe I don't know. Sometimes things would go up like you got scared one night and that's what it is, or you're nervous about a wedding coming up or something like that. So it's really nice to have that relationship so they can monitor what's going on. But I urge you guys to go to this page. It's on the link, but you could talk about what the results are, what, some of the insights that the physicians can have, and, really help, when we talk to the patients too, that they know when we tell them this is what this test means, that they understand it where they're at. Not everybody's a cardiologist, right? You got to understand, in lay terms, what's going on with your heart. I can use an example. My mom's 80 years old, and I talked to her doctor about what's going on with her so she can understand it too, because the last thing I want my mom, to feel is that she doesn't have any control over what's going on with her and her body and her, decisions for healthcare. So that's a big thing too that we push. All right, I'm going to exit out of this. Go back to this. Okay. I think I get it now, Sheila. So how is heart disease treated? And I do have another link, and I will do that because, again, this is just so much information that we want to make sure that you guys are aware of this and some of the new stuff. We always update our sites, but some of the guidelines for management of heart failure, heart disease, the best thing you guys can do, and I tell the physicians this too, when we work with them, we talk to them and the FQHCs, is to get a relationship going with the patients, that there's support available. So all of these are there for the providers to support the patients as they learn more about what's going on if they do have heart failure. If they're at risk, and that's another thing too, when you go talk to your physician about what's going on with your health, did your dad have heart disease? Did your mom? My dad died of a heart attack about 7 years ago. So it's really been on my heart, no pun intended, that I really should start taking better care of myself. My dad ate what he wanted to eat. Was he a big man? No. You wouldn't think he had any heart problems, but, he did what he wanted to do. He was 78 years old, but still, you definitely have to look at that and, take that into account too. It's like, what are some things that are handed down? And I always joke like, yeah, there's genetics and better, but I'm also handed down like beans and cornbread recipes and other stuff that's part of our culture, part of our family. And that is so hard to break. And I love that you guys were doing, Sharon shared the dining with diabetes. I think it's so important that you're giving patients the opportunity to make better choices on their term, where they're at, making healthy changes. Not that you're going to totally do away with stuff. We are practical. We all know there's balance, but maybe instead of doing this, you can still have that treat, that food or whatever, but you modify it. So that's another thing. We actually work with nutrition with some of our FQHCs.
Holly,
Mhm.
I was thinking, many years ago, when we were addressing and getting the word out about diabetes and the awareness of diabetes, that was kind of like, well, just because, I guess I'm going to have diabetes because it was a hereditary thing, and that the expectation was, yeah, I guess I'm going to have it too. And that's just life.
Yep.
And I think sometimes, and we know that heart disease and diabetes is sisters, they're very close to one another.
Yep.
But I also think that we have to have a change in attitude, as we did years ago with all the prevention that we eventually started doing to prevent diabetes, is to do the same thing with heart disease.
Yes. Oh, you are so right.
It's just such an extension to the whole thing. And I think about our children, we were talking about the African-American mothers and things like that, but, and women who neglect our health because we care for everybody else.
Yeah.
We put our health to the side so we can take care of everyone else. But, you're really taking care of your family, the whole family, when you make the changes at home with physical activity and healthier eating and those sorts of things. You're really addressing the whole family, not just yourself.
Right.
And a question on a side note, and I'll let you get right back, but while this is burning on my heart, no pun intended, again, right, is there are our children, we see children with even with type 2 diabetes now, our teens and things. And so what do you see the American Heart Association doing to address heart disease in younger people?
Yeah.
Because I know for a fact that you can, it's a mirror image. You see the mom and dad and you see the child.
Yeah.
And so are you seeing children with high blood pressure?
We are. I work with a few folks in the medical field, just kind of outside of the American Heart Association, that they have weight loss clinics for children. And I want to say it's like 12 and below is who they see. And there is an influx. You don't hear about it as much as you did before, a few years ago. Before the pandemic, it seemed like it was like what everybody talked about. But the American Heart Association had this for a few years, Jump for Your Heart. And it is a elementary school, middle school program that we have a few folks in West Virginia who do it. We have a northern position and a southern position where they go out to schools, and they educate all the grades at their level, because some talking about first graders, you're talking about food choices, and then maybe when you get on to talk about what is a calorie, what do you do? It's not more of a weight loss program, it's more of a lifestyle program.
Right.
But we are getting into the schools, and instead of going to mom and dad about it, we're getting to the kids, because we know that empowers them too. And they go home going, hey mom, I learned that if I exercise enough, and I won't feel so tired later on. Or there's a discussion about what is heart health. So we are doing that. And then with some of our FQHCs, we send some information to them. There is not an exclusive like, oh, well, children can't be in part of us self-monitoring blood pressure, because they are pediatric cuffs. It's not common, but I think a lot of what they go to is the weight loss, but then afterwards it's like, okay, they lose the weight, how do they keep it off, you know?
Mhm.
So
Yeah, and when you look at a child, and I'll hush right here.
no,
but
you're
when you
fine.
look at
This
it,
is good.
when you look at a kid that is obese, that is overweight, they don't have that small cuff,
No.
pressure
Right.
cuff. You know, they're
Right.
actually using an adult cuff because of their size.
Yeah, that's a good point.
Yeah,
Yeah.
so I just, I'm just thinking, our coalitions, they do a great job in working with adults and children, families in general. And
Yeah.
so this is some really good information. So sorry about that.
Oh
Holly.
no, this is great, because sometimes I don't have stuff in my slide that is what's going on, like this one. Like we have an advocacy position in West Virginia, and her name is, she's government relations director. Her name is Julie Tom. And right now, January through April is our legislative season, and she is right now going to bat for us to get a CPR training in schools. Last year we won big when we got water bottle filling stations in schools, because we all know, proper hydration decreases hypertension. So we're trying to just take a hold of things right now, what we can do for our children. Vaping, we're #1 in the nation for vaping in middle schools. West Virginia is. I used to work with another program with this. We got grants to go into schools to teach Catch My Breath. We also have the American Heart Association has material on vaping and smoking too, to give to schools. But we're noticing is that at the legislative level, this is where we can do some real huge waves in preventing adolescents to start getting hooked. And it just really, I don't know how it is and so where you guys are from, but it sickens me that I can't go down, and it's on the other side of the river in Canal City, 6 at least vaping stores, tobacco stores. And I'm gonna tell you what, it looks like a rave in there. If I was a child, I'd be very, very, very curious about what's going on in there, because it's so flashy and beautiful, and they market it right to our kids. So we're trying to fight some legislation for flavored vapes, flavored tobacco as well, because who needs cotton candy vapes? I don't understand it.
Right.
Because it tastes better. Well, maybe you should be putting it in your mouth. I don't know. So we're really trying to hit them with some type of legalese where they're, you can't start, marketing to our kids. I can't believe they're like, we have a middle school down the street from one of the vape stores, and I was like, wow, how does that happen? Because usually you can't have certain things near schools, but somehow there's a loophole and they get around it. So hopefully we can fill that loophole. So we're doing that at a legal point too, and the educational point and medical point that we're trying to help our kids. Yeah.
So there's a good word to get involved in legislation and your senators and all of that.
Yeah, if you ever catch a senator, one of your, you can know, because I know there's different states represented, on this call, but talk about, and in your county, what they're doing with vaping and tobacco, or any type of other legislation that would have anything to do with hearts. And we actually tried to get, approval that everyone on Medicare, Medicaid that would qualify, they give them a blood pressure cuff. Didn't go through, kind of stunk, but we're still making up with some of the other grants and materials that we're working with to get those out to folks who need them. So
thank you.
Okay. Early detection of heart disease. We talked a little bit about this already. Know your numbers, baseline family history, current healthy journey. That's what I'm on right now. We're all on that, but it's easier when you do have that. I have a history of this, and I have been through this, and you can relate to patients and where you're at, because as you said, Sheila, the moms, we do all the things and they look to us like, what's for dinner, Mom? Yeah, so that's really, it's been kind of hard to change some habits in my house to certain things. And for Lent, I don't know if you guys are celebrating or you're using this time to give up anything. We're not giving up things. We're going to incorporate healthy things. So every day of Lent, this time we're going to actually have salads for dinner. So that's what we're deciding. That's our little Lent, that we're not giving anything up. We're incorporating things. So that's going well. Yesterday was a hit. It was pancake Tuesday, Shrove Tuesday, Fat Tuesday, however you want to call it.
Mhm.
But we had some good stuff, and then now we have to eat healthy today. So
Nice. Thank you.
yeah, sure. So let me go scroll down here just a little bit. But for caregivers, I can kind of tell you that I lived with my grandma since I was about 9 years old to 18, and I was a pseudo caregiver because I was little, but I still understood what was going on with my mama. My mother lived with her, but you know, everything that my parents took care of her really too. But well, how many pills does she take a day? You know, knowing this about, you know, has anyone on this call have been in a caregiver role? It's kind of hard sometimes because you're like, wait, was that your appointment or my appointment? Is it your drugs? Am I filling this out for you or me? What's your insurance number? There's a lot of stuff. It's like you're another parent because you're filling in everything for them. So as a caregiver, what we like to stress too is like we have this wonderful checklist, you know, of what, you know, you could be asked during any type of interaction with medical staff or anything like that, you know, what's going on. Also for providers, that when they do talk to caregivers and patients, that they're inclusive in the conversation. Worst thing to do is act like that patient's not there, right? So it's like, it's a different dynamic when you do have a dialogue with the caregiver and patient. If they're sitting there, let them be a part of the conversation too. I used to be so upset. Sometimes I'd go with my mama and they'd be talking to us, and I'm like, you know, she's sitting right there. She might not remember us, but she knows what you're saying. So that, you know, some of the things that we do, you know, with heart failure. So, and also what I would say too, with some of the information that we put out there in the resources for caregivers, is that sometimes it's a vocabulary test. There's a lot of terms that, you know, sometimes I'm like, what does that mean exactly? When I started doing stuff with more clinical things, I would call my husband up all the time and be like, what does apnea mean? What does that mean? You know, like I had my own learning curve. So a lot of them, just because they're a caregiver, they might not understand just everything yet. And it's a learning process. So we tell folks, you know, in the FQHCs, you know, how are you guys doing with, you know, caregivership, or educating the caregivers about what's going on with their patients and their loved ones. So, okay. So what is the American Heart Association doing? And I alluded to, we have a great relationship with our FQHCs. We try to build capacity among healthcare and community systems to support patients and their family. So we, you know, any information that's out there, we definitely have a caregiver component to it. And also, what environment are we working in? Is it work? Is it school? Is it another medical facility? What are some community programs that are close to them? What's a policy that we can look at to make things better for the patient and the caregiver, or the community at large? Because one of the things that we kind of push is to use validated equipment. Is your equipment that you're using the best thing you can get to get a baseline, you know, of hypertension with a patient, a blood pressure? Sometimes no. Ooh, well, maybe you should look at this list of some really, really great performing blood pressure cuffs. And are you taking care of your blood pressure cuffs? Are you just throwing them in a drawer, or are you hanging them up really carefully, making sure that they're not getting, you know, miscalibrated and things like that? So we recognize, and if anybody's ever worked for a community center, they're the real heroes, especially with COVID. I always refer to COVID because it really just kind of stood out about how the health systems in the community really work, because we depended on them so much. And then we're mirroring a lot of their programs, their, you know, the feedback that we got, some of the programs that they started and failed, even that was like, hey, that's really good feedback for us, because we want to know what works. So the community health centers are saving the day, and that's who I work with mostly on the daily. And there's new ones that seems like it's popping up all over the place. And there's also new ways for them to help too, because there's new initiatives that they learned that we can learn from them. So this is just a list of why it's really good to work with your own health centers. You know, tap somebody. I have a new one, like we were talking about, you know, Tug Valley or Tug River. And I was so appreciative, because usually I'm the one that's cold calling going, hey, I'm from the American Heart Association. What are you guys doing for hypertension? And it's a breath of fresh air when we get a call going, hey, can we partner? Because we've noticed we're having an influx of patients who have chronic disease and have issues with hypertension. So what are some programs we can have? And it's like, that's when you give a high five. It's really a good day for that. So, so we're talking about, there's some programs that we get hospitals, clinics, and other FQHCs involved. We have the National Hypertension Control Initiative. And this is basically a HRSA funded program that some FQHCs, clinics that have been recognized as they need some help. So maybe they weren't performing as much. They were given some grants to start some hypertension programs. They're partnering with us that we can facilitate more support for these programs as well. I have 3 in West Virginia. And sometimes if you don't know, if you're working with an FQHC, you can ask them and be like, hey, are you part of this program? And if they're not, that's okay, but there's still some programs out there that they can join or hop on a call to learn more initiatives to incorporate into programs that they already have. So, and then some of the other initiatives that we are doing. Oops, I lost my place. Here we go. You might have saw these on like commercials or programs that you're out there, you see on our website, but these are just a list of things that we are really trying to endorse. We have a new one. I'm sure folks have heard about Damar Hamlin. He was the football player who was unfortunately suffering horrible, just out of the blue, the way his heart was beating and the way he was hit. It was just the craziest thing that happened. But it wasn't for his trainer doing CPR on him, he would have not survived. And he has partnered with us, and it's called the 3 for CPR challenge because his number was 3. So Damar has now urged people to get CPR trained. We're not like the Red Cross where we have like a certification class all the time, but we know that if you're trained, that you can save a life, or trained by us, or the Red Cross, but you don't have to be certified as much. There's lots of videos I can send you the link to for Damar's challenge, and it's really, really great to get started. It's one of our new challenges. I didn't put it on this list, but that is something that we're really trying to push, especially for Heart Month, that we're doing CPR. I've done a few CPR trainings myself. They gave me a kit, I went out, we talked about them. We had the big mannequins. Funny story, I got pulled over because by the state trooper because he didn't realize what the mannequins were. He thought it was an understrained kid in the back of my car. And this is little mannequin peeking out, little Annie doll. Her face is peeking out, and then he got up to my car, and I guess he realized what they were. And I just looked like I wasn't speeding, my license good, everything was good, registration. And he said, "Get out of the car, I want you to look at this." And I thought, oh my goodness. And I go, there's this little doll peeking out my window. So he thought, I first thought it was a kid that was unrestrained. I was like, oh man, this is a really good story. So
and then he comes to the window and sees it's only half a body.
Yeah, and the face was coming off. That was real great, but it's a funny story. But so we go anywhere with our mini Annie mannequins. So I encourage you, if you're not, maybe it's been a while since you took a CPR class. Like I'm gonna get this and put it in the chat. But I would definitely look at this video. I think it's like 2 minutes. You can definitely get a pillow and do the compressions that way as well. Or, if you have a volunteer in your home, maybe they could be the mannequin for you. But just knowing that you are trained, that you're aware, it really empowers you to step in if there was ever a crisis. We definitely like to do that. And
Natalie, we have a question from Angie.
Oh, yes.
Hey, this is Angie from Johnson County, Tennessee.
Hey.
We have scheduled to do some hands-only CPR training with 7th grade students in PE classes next week. And I see on your list here that you've got mentioned that CPR training for high school. I was just curious, is there sort of an age limit? What do you think about 7th grade, 8th grade, as far as hands-only CPR training? This is kind of an experiment or a pilot a little bit. It came as a request from a school nurse who was just curious about whether or not we could do it. And a few of us put our heads together and said, well, hey, let's just try it and see how this goes.
I've never heard of a limit, like an age limit, here's Damar's link right there. Never heard of an age limit. I would think that you said 12 years old.
So yes, 12, 13.
I think that's a really great age. I mean, when I was trained, I was in high school. I was 16, maybe 15, but it was like, when they're kind of out on their own, being responsible, they're going to have sports, they're going to have band practice and whatnot. And maybe they could start it, because if you think, when you do compressions, that's a lot of force, but maybe they could walk or tell somebody and walk them through it if they're not, confident enough. They could be the voice going, I can call 911 and help, because you never know. It could be a little smaller child and they could save a life.
Right.
So,
and that's the bigger piece of this too, is that they are just comfortable with what needs to be done, whether that's
exactly
compressions or whether that's them actually making sure that they've activated, an emergency, whether that's through a call, getting another adult, or whatever needs to be done, depending on where they're at.
Yeah.
So when I saw that on the list, I just thought I would throw that out there, because we really didn't know for sure. When I say we, I work at the local health department.
Oh, okay.
We've involved, of course, coordinated school health in our school district, and our local EMS service, who's going to lead the training. And we're going to keep it rather, just very basic and hands only, as far as that goes. But anyway, I just wanted to toss that out and see if you had any thoughts on that.
Yeah, I'm so glad. I think it's so responsible of you doing that, because I would hate to think that if my kid was somewhere and just with a bunch of kids that nobody knew how to do anything. And it also gives them the confidence to ask for help and not stay there and not be so scared. You know what I mean?
Yes.
That's a scary situation. And I think you're preparing them. And if I can find out some information too about training some high school stuff, folks, or middle school, I will send it to Sheila to send out to you, because like I said, I never heard of, now 7-year-old, yeah, probably too young, but like 12-year-old, I think that would be a really good place to start. And that could be something that they can do every year,
Well, that's what, if it goes the way that we're hoping that it will go, that was kind of the plan, as we'll pilot this right now, see how that goes, and maybe try to implement something of this nature every February within the school district, and, maybe add some more grades if we have the capacity to do that.
Yeah.
Up through high school.
Yeah, definitely high school. That's really great, Angie.
Thank you.
Thank you.
Okay. All right. The next slide we have is a national spotlight on Heart Month, some of the initiatives that we focus on. Reclaim your rhythm. We also have one, Be the Beat. That's the new theme. Talking to your doctor more, it's like getting back into the doctor's office. Go Red for Women. It was the first Friday in February, but I wear red all the time, obviously. But it wasn't my main color, I guess. That's what my thing was. It was like, usually I was always wearing blues for my other job, but now I had to buy a bunch of red stuff, and I'm like, okay, cool. But also knowing the warning signs of a heart attack and stroke. Another good thing probably to talk about is FAST, talking about the signs of stroke, and maybe teach that to your students too when you do CPR. Maybe they're with their grandparents and they need to understand what the signs of the stroke is, and definitely could be, calling them, an ambulance or something like that for their mama or papa. So never know, or their moms and dads, for that matter. I think that's it, Sheila, unless I have any more questions.
Yeah, does anybody have any more questions?
Really good discussion. I like to know what you guys are doing for hypertension or anything. You're Sharon was just saying that she's doing like a lunch and learn tomorrow, and Angie's doing CPR with some students. Is there anybody else doing anything, any trainings or?
We do CPR and first aid here periodically, like we try to do it once a quarter.
Oh, nice.
Our last one had to be postponed because of their funding. So hopefully we'll get back on track. But she had wanted to do one during February because of Heart Month. But
yeah.
hopefully soon.
Yeah. Well, there's always stuff you can do. Like there's stroke month. Next month is heart or women's health month. So you can always do something around that as well. And we're here for you. If you want anything from us, make a presentation, we can do a lunch and learn, Zoom, get out to see you. Just let me know, because we definitely
Okay.
love to get out in the community. Yeah.
Yeah, we would love that, Holly.
Nice, really nice.
And does anyone on the call today, do you work with your American Heart Association? Or Holly, I know they're set up in regions, if my mind serves me correctly. And just out of curiosity, if anyone else on here, Angie, Natalie, or
I'll be honest, Sheila, this is Angie. I'm not even sure who our person is anymore for my region. They used to reach out to us quite a bit, and I'm sorry, I'm at home with a little bit of a cold today, so I sound horrible, but I'm not sure who our person is for this region, to be quite honest.
Okay. I don't know, because we're Eastern States, which is like Maine down through Virginia, and the cutoff is like Ohio, Kentucky, Tennessee is on the other side. I could try to find out for you, or if you call, I'm trying to think.
If there's a number maybe that folks could call if they don't know who their contact person is for their region, for their county, because who knows? I mean, there could be a lot of good resources right there, and if a call is made. So yeah.
If you want to put your contact information in an email to me or in this chat, I would be happy to follow up for you.
Yeah, and I will I'll actually, when we get off of this call, I'll go ahead, if you don't care, Holly, and I'll send the your PowerPoint out and your contact information. And then this is being recorded, but it'll take us, several days to get the recording up. And that way you'll kind of have the information, and I'll send the link out to the recording later.
Yeah.
When it comes available too. So,
hey, Sheila, this is Angie.
Yeah.
If I could just share real quick, I think kind of a highlight. One of our schools, we're also doing the Kids Heart Challenge at an elementary school, and we're focusing on 4th, 5th, and 6th grades in that elementary school. This is the second year doing that. Last year, there was several components. Part of this is done by their PE teacher, where they learn about the heart, the structure of the heart, and the flow of blood and things like that. Then they all last year sat through some sessions where we taught them a little bit about things that affect their heart, specifically tobacco, nicotine, vaping, and those sorts of things. This year, we're really focusing a little bit on coping and anxiety. That's something we've observed. And so they are making their own calming jars. So they get to learn about the heart and the effects of heart, but then we're also talking a little bit about stress and how stress affects the heart. And so with UT Extension, Coordinated School Health, the health department, and the school district, we've purchased the materials, and UT Extension has it's one of their projects they have for making their own calming jars. And so we're doing that actually this week and next week with students in that school.
That is wonderful.
Good job. And Sharon had another question, Holly, too. Is the cooking, does the American Heart Association have the Cooking for Heart program?
Yeah, I'm trying to find the link for that, but if you Google American Heart Association Cooking for Heart, and there's like a bunch of like links that come up within the program. I'm trying to snag this for you. Cooking for Heart. Simple cooking with heart. And it's a bunch of recipes too. but I'll send that to you
Okay.
as well. Copy, here we go. But you could search within that too. They have a lot of health topics and like dietary guidelines, recipes,
Mhm.
different tips too. And then a lot of this is when we work with our partners, FQHCs, other community organizations, we kind of give them the same thing too, because it's all available to everybody and they can send that stuff, printables, PDFs for their patients too.
Awesome.
Yeah.
All right. Any other questions for Holly? All right.
Nelsie with Community Health, Eastern Tennessee, has an Appalachian diabetes grant and community is Campbell Gets Fit. Oh, that's awesome. I like that. I love it. We can all share, but then you have your own little like individual community coalitions and communities and things like that. I think that's great.
Yes. Yes.
Thank you.
All right. Well, I appreciate everyone. I've got 1 o'clock. Unless you have any other questions, I'll give us a minute. And if not, we'll send out the link to this, and most likely, let's see, this is Wednesday, probably early next week when the link is available, but for the recording. But in the meantime, I will send out the PowerPoint. So those resources will be on there. And then I copied those 2 links that you shared with us, Holly. And so I'll include those and on an email out to everyone as well.
Okay. Sounds great. Thank you guys so much for having me.
All right. Thank you.
Thank you.